Okay, we are back. Final full segment, everybody, with Dr. Aima Ahonkhai from Vanderbilt, who is joining us tonight to talk about COVID-19 booster shots and what you need to know. Before I get to our next caller, Doctor, I will ask you, what is your basic answer when a patient or maybe someone you know who maybe is still unvaccinated or is and might be eligible for the booster, who has concerns, who says, I read things on the internet, and how do you answer that question and try to kind of convince them, hey, this is okay?
Well, I see my job as a public health practitioner and as a doctor is not to convince anyone to do anything, but to provide information, factual information, and help them to make an informed decision. I think that there are a number of reasons that people can be vaccinated for their own health, for the people around them, their community. And then, I think the larger communal and public health perspective is just to get us out of this pandemic and return to some level of normalcy that we're all craving. And then I try to make sure people have, like I said, accurate information about how the vaccines work, the rarity of side effects, because, we talk a lot about them, but they still are quite rare. And really, some of this is understanding what the cost and benefit is, that we weigh for any important health decision that we make. What's the cost? What's the benefit? For me and for many of us in the health community, that means that we are on the side of getting the vaccine and distributing these vaccines and trying to promote the public's health. And I hope that people can feel comfortable in making an informed decision after I talk with them, my patients.
All right. Again, caller on hold. Hang on. I'm going to get to you in 2 seconds. But since this is our final segment, I have to ask you as we talk about this, because you mentioned earlier about access. And this is an important question, too, as we move forward years from now and we're looking back, okay, what were the best practices? What did we do right? What did we do wrong? And obviously, you've worked internationally. There are a vast majority of the world's population, I mean, it's sad, but are living in poverty and just don't have access to adequate health care. How do we move forward and try to address this serious situation?
Yeah, this is an excellent question, because we're having a lot of discussion in this country about vaccine hesitancy and vaccine uptake from a very distinct position of privilege, where we have the ability to vaccinate our entire nation. Whereas we have low and middle income countries where vaccine is just not available in the same way it is here. And so I think, there are a lot of conversations about sharing, about vaccine sharing, and how to administer and deliver vaccines to low and middle income countries where the resources aren't available. And I think that requires a political commitment and a political will that, appreciates not only, what is the right for human health, but also, if we think of it even from a selfish perspective, we can't control a global pandemic if a large majority of the world is not vaccinated against this virus. So there's still a lot of work to do there, obviously. Yeah.
Good point. All right, let's go to Chris, waiting patiently on line 2. Hi, Chris.
Howdy.
Hey, go ahead.
What I wanted to ask her is, yes, I went through chemo.
Yep.
And after I got done with my chemo, I got testicular cancer.
Yep.
I came down with a blood clot in my leg.
Okay. And was this after did you get the COVID shot?
Well, I came down with COVID after Thanksgiving of last year.
Okay.
I got my COVID shot. I got my second one.
When did you get the second shot, Chris?
I got my second shot in April.
Okay.
I got my booster shot.
And you got your booster also. Okay.
I got the second shot
the
in
second.
April.
Okay. All right. And when was the blood clot?
The blood clot was right before July of last year.
Okay. Sorry, I'm going to ask another question here. When were you what kind of cancer, and what was the chemo for, and when did you wrap that up?
I wrapped that up 2017.
Okay, so earlier. And have you been cancer-free since? All right, we'll hold there. You got to turn your TV down. I know there's a delay that messes everybody up. But what we know from here, he was concerned, I guess, about a blood clot, doctor, like the other caller.
Yeah, it's hard to say specifically. Obviously, we have some concerns about blood clots with vaccines, but people who have cancer also are at higher risk for blood clots from the cancer itself. So not knowing the specifics of where he is in his cancer treatment process, it's hard to know.
Right.
I did mention before, the one that we've seen a higher risk of blood clots with is the J&J vaccine, but again, that's with really young males, 18 to 49 years old, and it's a pretty rare complication. But if that's his concern, I would definitely talk to his provider. I don't think that's the one the vaccine he said he received.
Yeah, yeah. And I think I stumbled upon before talking with you tonight a more recent study that looked into that, a serious concern that looked into the blood clot issue, and it showed even it was better results showing that it's not quite an issue, as much of an issue as some people had made it out to be, right?
Yeah, that's right. And I think the most important issue is that the risk of, and we see this with a lot of the side effects we're concerned about, the risk of blood clots, inflammation of the heart muscles with COVID infection is magnitudes higher than any side effect we see with the vaccine. So we're really trying to prevent these kinds of complications in people who get COVID. The very rare side effects are truly that they're just rare. They're not seen commonly at all.
Yeah. Exactly. All right. Some really great information. And, like we said, the information, you said a great word, how healthcare providers, as wise as you all are with all the experience and education, that this has humbled you. But we say thank you to all of the healthcare workers. What a year and a half or 2 years it's been. But again, the information continues to come in. The research is ongoing. We're going to continue to listen to experts like you and try to make the most informed decisions. That's the best we can do, right?
That's right. That's the best we can do.
Thank you so much for being with us. As always, we appreciate it. You have a great evening, and viewers, we'll be right back to wrap things up after this.